Hi, welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. Today is the last episode, or this is the last episode of season one, and I'll be discussing the updated Ontario cervical screening guidelines. I wanted to discuss this topic because screening is important and because it used to happen every 3 years, and it's important that we have the updated information to make plans with our healthcare provider. As of March 2025, Ontario transitioned to HPV testing for cervical screening and colposcopy, which replaced cytology, otherwise known as pap tests. This change occurred because it's been found that HPV testing is better at screening for precancer and early cancer. Now, there are over 100 different HPV strains, and while not all of them have the ability to lead to cervical cancer can begin as an infection from a high risk strain of HPV at the cervix. HPV is transmitted from sexual contact of any kind with another person. In this instance, sexual contact includes contact with another person's genitals, for example, using the mouth, hands, genitals, and toys. Eligibility for HPV testing has also changed. If you meet the following criteria, you are able to get cervical screening: have a cervix, be between 25 and 69 years old, have a history of sexual activity, which is any contact with another person's genitalia, hands, mouth, genitals, and sharing toys, no symptoms suggestive of cervical cancer, and are OHIP covered. If you have a cervix and have ever been sexually active, screening begins at 25 years old. This is also consistent in people who are immunocompetent, immunocompromised, or vaccinated for HPV. Screening is not recommended in people who are younger than 25 and have been sexually active, or people who have never been sexually active. Screening recommendations have drastically changed. Previously, follow ups were done every 3 years, but research has showed that a negative HPV test every 5 years provides at least much protection as a normal cytology test every 3 years. For people at an average risk, they should be screened every 5 years. For people who are immunocompromised, they should be screened every 3 years. For people at moderate risk, they should be screened every 2 years. And people at elevated risk should be getting a colposcopy. A colposcopy is a procedure where the cervix is more closely examined using a bright light and examining lens to determine if anything abnormal exists. A biopsy may be done of the abnormal cervical tissue for further testing. Now, as I was going through the screening recommendations, you might have noticed that I spoke about risk. Elevated risk factors include people with HPV positive types, type 16, 18, 45. People with HPV positive test or other high risk types and high grade reflex cytology, and people at elevated risk are referred to colposcopy regardless of their reflex cytology test results. Those with moderate risk are people with HPV positive, other high risk types, and normal reflex cytology or low grade reflex cytology. More details can be found in the resources. Screening stops based on a few factors, but generally, if you have a negative test between 65 to 69 years old, you can stop screening. I'll also share a table from Cancer Care Ontario, which has more detailed information on when screening can stop. While screening is not recommended for people over the age of 75, visible cervical abnormalities or abnormal symptoms um, investigation should recur regardless of their age. HPV screening cannot be done by naturopathic doctors. We can only do pap tests at this moment. Midwives may be able to provide HPV testing. And so, if you're due for a screen, it may be worthwhile to ask this before your 6 week discharge appointment. Thank you so much for listening to this episode. about the updated cervical screening guidelines in Ontario. I hope you found it informative. As always, please subscribe to this podcast, leave a review, or follow me on social media. I'll be back next season. Take care.